Dr. Steve Edwards here with Renews Oral. I say that 80% of most common dental problems are avoidable easily. And we only have really two main dental diseases to worry about: tooth decay and gum disease, okay? And it's real easy to solve these problems for most people. I also say that dental problems are the easiest health problems to solve that have the most benefits for minimal effort. And if you just improve that minimal effort, you can easily avoid most of the common dental problems that are linked to cavities and gum disease, which is about everything other than oral cancer, and maybe oral cancer is partly linked to gum disease a bit too. But in general, just cavities and gum disease, easy to prevent. Let me show you what I do. I'm going to start doing some videos that go through my daily routines and show you what I do, kind of like Trent Harrison or Damian Bankhead do when they talk about their fitness stuff that they do, okay? If you remember the City Slickers movie with Billy Crystal and Jack Palance as Curly, okay? Anyway, Billy Crystal and Curly, they were riding on horses and talking about life and stuff. Jack Palance said, "You know, the secret to life is one thing." And Billy Crystal said, "What, your finger?" No, it's one thing. And everything else is BS, basically. And Billy Crystal said, "Well, what is that one thing?" And Curly said, "That's what you got to figure out," okay? Anyway, so I've boiled down to the one thing of dentistry, or oral health, or dental health, or oral systemic health, or mouth-body fitness, whatever you can call it. And that is, do not leave stuff on your teeth longer than about 2 minutes, or maximum 12 minutes. Try to get stuff off your teeth as soon as possible. And even while you're eating, you should be rinsing your mouth, or you should be drinking water or swishing water around in your mouth a little bit. You don't have to be obvious about it, but take a sip of water and swish it around a little bit. Nobody has to notice it. And after you're done eating, you can be swishing around as you're cleaning the table or whatever. You can swish water around while you're setting up your table too, or washing dishes, or getting ready to watch TV, or whatever. You know, I also say multitask. Multitasking is critical. A lot of people don't believe in multitasking, but in oral health, multitasking is critical. Because guaranteed, the microbes that are attacking you are multitasking against you. So you might as well fight back even more than they are against you. All right, so step number one, don't leave stuff on your teeth longer than a few minutes. And here's what I do after I have a snack or a drink, anything with carbohydrates in them, any food anyway, okay, because most foods have some carbohydrates unless they're pure protein. Actually, a little known fact is that there are microbes in the mouth that can split your mucoproteins in your saliva into carbohydrate and protein. So mucoproteins are a combination of protein and mucus, which is a carbohydrate. And so these bacteria can split those apart, and some bacteria can eat the proteins and some can eat the carbohydrates, and then you can have acids from that. So anyway, here's what I do after I eat, snack, drink, whatever. And that could be as many as 7 times a day or so. I don't eat meals 7 times a day, but I might snack 7 or even more, you know. Eat meals, snacks, whatever, drinks. Okay, so the simplest thing is just rinse with some water. So I will just get some warm water. I like it to be warm. Well, some people are sensitive to cold water, okay? But anyway, I like warm water because that helps to loosen up plaque a little bit more. Obviously, cold water is going to congeal the plaque, okay? And you want warm water to kind of loosen it up, okay? So I just get some water here. I don't have a lot, just like this. And then I just swish it around. Not going to show me spitting out. But I actually add some air bubbles in the water, like a tornado going on in your mouth. The air bubbles in water. It can't just be plain water. Just plain water without air bubbles isn't so cavitational, you might call it, okay? So make sure you have some air bubbles in your mouth and swish that around. So I swish that around and spit out at least 3 times. I had one time some Cheetos. It took me more than 6 rinses, and actually up to about 11 or 12 rinses before I had all the goo out of my mouth from the Cheetos, okay? So most people are walking around with a bunch of goo in their teeth, and I see it every day in the dental practice. So you got to rinse out at least once, and maybe 3 times, and maybe more with other things, okay? Now, there's something else you can do. I've had about 38 different jobs, and a few of those have been in factories and places where we had dangerous chemicals, and we always had eye wash stations. So we always had to rinse our eyes out if we had acid splashed in our eyes or some dirt or some junk or whatever got in the eyes. So what you need are like dental eye wash stations. You might say for your eye teeth, you know, but dental wash stations, teeth wash stations. You should have teeth wash stations throughout your house or wherever you are. And think of acid on your teeth. Every time you have some food, you can be developing acids on your teeth. So if your teeth were eyes, I guarantee you'd be blind by the time you're maybe 2 years old or something, or even younger. So anyway, you rinse out several times.